I'm Dr. Michael Pippin. I'm a board-certified gynecologist. We're going to talk about gynecologic cancer, which is a pretty broad topic, but we're going to limit ourselves to talking about a little bit about ovarian cancer today. Ovarian cancer, it can certainly be sporadic, meaning that all people are at risk, but certainly people who have hereditary factors are at greatest risk for ovarian cancer. Ovarian cancer is not as common as uterine cancer, but it's more deadly. Until the modern times, we really didn't have a great treatment for ovarian cancer, but now the development of modern drugs has turned ovarian cancer into not as deadly a disease, but more of a chronic illness that people can live with. So that's the good news. The bad news is that people are still not being diagnosed early in the course of ovarian cancer, and that's because we don't have a great screening test for ovarian cancer. We know that people who have certain genetic factors are at risk for ovarian cancer, and all gynecologists should be asking about the family history and screening for those genetics. But most people who have ovarian cancer have it sporadically. They don't have these inherited factors. So all women need to be aware of the earliest signs of ovarian cancer, which are subtle, and those signs can be just bloating, swelling of the abdomen, and just some vague symptoms. So that's something always to discuss. And if there's any suspicion of those kind of symptoms, there are tests we can do, such as ultrasound and blood tests. But we're still working on a great screening test for ovarian cancer. Again, ovarian cancer we're still waiting for that great screening test. A number of people ask us about getting ultrasound or a blood test for ovarian cancer, and those have been promoted, in the general media, but they haven't been proven to be effective, but in certain high-risk situations, those things are important. The most important thing is to be aware of your family history and get that genetic testing if you fall into the group that needs to have it done, and to be aware of those early signs of ovarian cancer, which are kind of vague, and to pursue a workup if you have those symptoms. Again, ovarian cancer is primarily staged by having surgery, and if it's early stage, then hysterectomy and removal of the ovaries is important. If it's latter stage, then removal of all visible disease is important, and then follow-up is usually a chemotherapeutic protocol. Plus, now we have unique biologic therapies that work well for ovarian cancer. For women in general, they should be aware that getting regular screenings, and that includes both Pap and HPV testing for the appropriate age group, is important because that's the best way to prevent the development of cancer or diagnose a precancerous condition early on in its course. Plus the other benefits, general health benefits of getting screenings. Often people think they have a variety of other conditions like indigestion or gas or things like that when it's something more sinister. So being aware of those signs and symptoms of ovarian cancer and coming in right away rather than just attributing it to something else is important.